As we continue on with some of these anxiety disorders, we'll look at GAD, which is GAD or generalized anxiety disorder. And these are individuals who are just cumbersome worriers, and they honestly cannot help it. It is not that people would like to worry constantly about everything. It's very uncomfortable. So it can be uncomfortable for you as the friend or the colleague, the family member, but imagine how that individual feels where they are just so anxious all of the time that it's debilitating. They may have panic attacks. Which is brings me to my next one, panic disorders. And sometimes anxiety can trigger a panic attack. It is not uncommon for multiple disorders to be found in conjunction. And when we identify the primary disorder, then sometimes the anxiety or the panic or the OCDs and things like that will go away on their own because they were really just supplementing aspects to the major depressive disorder. But panic attacks are a real thing. Look at some of the symptoms. Acute anxiety reactions that bring on a physical, biological, chemical, bodily response. And it's not just in people's head. Once again, the mind and the body are interdependent entities. We are a conglomerate of things that we have to acknowledge and appreciate on a holistic level in order to deal with psychological problems. OCD is another one. Now, there's a difference between your level of OCD where you like everything perfectly organized and all the boxes facing the front. You're probably fine. But OCD can also be extremely debilitating, just like some of these panic disorders and anxiety issues. OCD can be truly obsessive and compulsive, where peace, relaxation, and cessation of that particular exercise or activity literally cannot be stopped without the individual going into a panic attack. So sometimes, these things, we look at them, we read them, we make slight of OCD or ADD or bipolar disease, or we have little cute names for different types of dissociative disorders. But the individual is really suffering. There's a whole person behind there, and that's one of the reasons why the stigma is there, because of the way that we react. Because if we don't understand the disorder, that person is crazy. And it's very dismissive. It tells them that they don't matter. And then all of these aspects right here, the panic disorders, the general anxiety disorder, the phobias, the OCDs, the compulsive disorders, these are actually intensified because of that. So we as a community play a very important role in actually helping to curb and flatten some of these disorders. And of course, PTSD used to be thought of as a military-only disease, which is completely untrue. It's not specific to anything. There are individuals who have suffered childhood trauma, adult trauma, a variety of things that suffer from PTSD. It could just be a physical illness, and the way that it was handled and the discomfort and the agony and pain you went through, you may have PTSD, or maybe you witnessed something. So it's not just for individuals who have been in war. But there are a litany of issues that cause some of these mood disorders, and one of them, or some of them, are interactions between biology, the environment, people. Sometimes the folks you hang around will bring you up or down like an elevator. Hormones, that's a real thing. People going into puberty, men and women, young girls and boys passing in through adolescence, that can be a very tricky time for them going into high school or going into college. These are issues that sometimes we undervalue or we underappreciate the impact they have on somebody's psychological health. Body image, particularly for young girls and women, the way that your hair looks, the way that your skin is, if you shave or if you don't shave, if it's natural or if it's permed, if it's colored or if it's this, all of these things. So people can have a tremendous effect on your psychological well-being. And the things that we experience in trauma with our childhood and never deal with until our adult lives. These are things that our body is literally storing up, and it's waiting for us to help it, and we don't. So sometimes when you're asked what's wrong, or when you are trying to deal with an issue, you literally don't know what's wrong because you've been suppressing things for years. So it's important that you get the help that you need. There are several types of depressions, and the several slides earlier, I wanted you guys to kind of go over them and read about the bipolar disease, the seasonal depression, things of that nature. And sometimes they have a genetic aspect, a genetic predisposition or component, and knowing your family history is extremely vital in order for you to be able to be treated successfully. So, there are so many reasons why people can have triggers of issues with loss of a job, of a relationship, death in the family, financial issues, and they can all be brought about by quite a few of these things. So skipping over again, am I going the wrong way? Okay, so now we have what causes some of the anxiety disorders, and biology is one of them. Hormones changing in individuals who have ADD, particularly the non-attentive type, and they can feel kind of just monotonic all the time. Sometimes their brain doesn't produce enough of certain chemicals, and that's why they're on medications. It's also not uncommon for individuals with depression to have a form of ADD or ADHD. And you'll find medications like Strattera and Adderall and Ritalin Concerta, which is a long-acting form of Ritalin. And there's a variety of other ones out there too. And these actually help to increase the levels of certain hormones in the brain so that these individuals can function at a normal capacity. Now, if you take it and you don't need it, then some other effects will happen. They're not favorable. It's very common on college campuses for Adderall and Ritalin to be peddled along. They're known as like smart drugs. It's supposed to make you more smart. Well, nothing can make you more smart. It's basically legal speed. So my recommendation is don't take it because it's not healthy, but it's also illegal and you could go to jail. That's a felony. But these are some of the issues when we look at biology. Medication will help to regulate some things that are genetic and help to put you back on an even playing field with your peers. Your environment, anxiety, panic attacks, depression, all of these things are related. And stress from school can cause a panic attack or anxiety attack. Stress from work, stress from maybe you don't even know what it is and you just feel on edge, then that's okay. It's okay to feel like that, but more importantly, it's better to get help. And then social and cultural roles, even looking at sexual orientation, preference, and identity, those are just massive because depression, suicide, anxiety, and other mental illnesses are extremely high in the LGBTQ plus. I know they added on acronyms. I don't know everything, but it's much more prevalent from a statistical point of view in those marginalized, discriminated, and not always accepted populations. Our personality disorders, we have a paranoid personality disorder. This is, just think of the person who has unfounded accusations, thoughts, and fears, and literally none of those things come to pass. They may be suffering from an undiagnosed or diagnosed paranoid personality disorder. Maybe they are jealous over the little bitty small things. Maybe you said hello to another gentleman in the grocery store, not because you were flirting, but because he was a cashier and your boyfriend went off the deep end. So it's just a symptom. It's not a cut and dry diagnosis, or these symptoms may not be present in everyone, but these are just some of the things you can look out for in conjunction with other factors. Narcissistic personality disorder, oh, I could speak for days on an individual that I used to live with after my mother passed away. She's probably the most narcissistic individual that I have ever encountered, and won't even admit that there's a problem. They just have a very high, exaggerated, unfounded view of themselves, put themselves on pedestals. They talk down to everyone else. They don't realize that how they come off to other people, but they think that because they put themselves on this high pedestal, other people also do, when in reality that is almost never the case, almost never, and they are seen as undesirable characters. But once again, because of that heightened self-value unfounded. They don't see that everybody else actually thinks the complete opposite of them. And you probably know a couple of people like that. And then there's borderline personality disorder, and this is characterized by I'll think about the consequences later type of actions, impulsiveness, risky behavior. Some of this coincides with bipolar disease. Individuals like this may have some financial problems due to overspending, gambling, excessive consumption of drugs and alcohol, because you get those feelings of euphoria, just very risky behavior. They put themselves at risk for higher levels of STDs because of their risky behavior. Adrenaline junkies sometimes are what we call them. Moving on to schizophrenia, very few people are actually affected by this disorder, but we seem to have a little bit more understanding sometimes because of how it is depicted in the movies and in cinema. And I use that word understanding very loosely. So not a lot of people, about 1%. This is depicted by alterations of your senses, which means basically they're not functioning in the intended capacity. They're just malfunctioning. You're not able to really place stimuli and appropriateness, social graces in the appropriate category, overreacting, underreacting, not having apathy. You may not quite feel like yourself. You may have a heightened sense of self. You may sometimes have a very low feeling of self-esteem. There are massive changes in your emotions, maybe from one moment to the other, maybe from one day to the other, maybe from week to week. And that encompasses not just your emotions, but also the things that you say, the things that you do, your body movements. And some of these activities can be extremely violent, odd. They can be risky to family members. They can be off-putting. They can be scary because you don't know, you're not a mental health professional, so you may not know how to deal with it. And understanding and recognizing these things is very important. Suicide, again, these are found in large numbers with the gay, lesbian, transgender, asexual population. It's also found in high numbers in college students. A few slides back, we focused primarily on the feelings of being overwhelmed and having thoughtlessness or hopelessness and anxiety. But right underneath that, the statistic noted that about 10 to 11% of college students seriously considered committing suicide. And just the thought of that on Pierce College's campus can be very vexing to some individuals. It's the third leading cause of death for 15 to 19-year-olds and the second for 19 to 24-year-olds. So when you're looking at the ages of 15 to 24, 25, formative years where you're making critical life decisions, you're looking at how the trajectory of your life will go. It's very stressful, and especially if you're in a marginalized population. That's why we have to be very understanding and considerate and cognizant of what other people are going through, because everybody got a story. Looking at some of the warning signs of suicide, these signs will help you be able to recognize if one of your relatives or friends or peers, etc., are perhaps going down that path, and maybe even you recognizing it in yourself and being able to take those steps to get help. But those include recent loss, somebody dying, job loss, particularly if you are a sole provider or the primary breadwinner in your family, massive changes to personality and mood, feelings of hopelessness, overwhelming feelings of hopelessness, not just a particular day of sadness, preparing things for the end of your life, making a will, talking about suicide. All of these things are warning signs, and it's important to take these signs seriously, because I did know an individual who told his friends, I feel like I'm going to kill myself. And they said, man, you're going to be fine. Athletes. And they rubbed him off, and he shot himself in the bathroom with his girlfriend or fiance downstairs. So take these threats seriously. Don't belittle the individual. Make sure that they know that you are a resource for them, because they may have come to you because they feel that you're their last hope. So don't squander that opportunity. This is simply a list of some of the different types of mental health professionals. Psychiatrists are medical doctors. Psychologists usually have research doctorates. Then there's counselors. Those are master's degrees. They're trained with a master's degree. And then we have psychoanalysts. The most prominent are psychiatrists and psychologists, but there are other options. I hope that you'll use this information if you do need it.